Cases of the Omicron variant of the coronavirus were reported in the United Kingdom, Germany, Italy, and the Czech Republic just days after being identified in South Africa, leaving governments around the world scrambling to stop the spread. Australian authorities announced on November 29th a third case of Omicron COVID-19 variant.
We take this Omicron variant very serious, and we know that we are now in a race against time. Why that? Because we know not all about this variant, but it is a variant of concern. And the scientists and manufacturers need 2 to 3 weeks to have a full picture about the quality of the mutations of this Omicron variant.
Omicron carries a high number of mutations in a spike protein, which plays a key role in the virus's entry into cells in the human body. The B.1.1.529 variant has 50 mutations overall, including more than 30 on the spike protein. The Omicron variant was first detected in South Africa on November 24th, with cases gradually occurring in Botswana, Israel, and Hong Kong. According to the WHO, the virus variant has some concerning mutations that suggest an increased risk of reinfection. The United Kingdom on November 27th tightened its rules on mask wearing and on testing of international arrivals after finding 2 cases.
Traveling, but we will require anyone who enters the UK to take a PCR test by the end of the second day after their arrival and to self-isolate until they have a negative result.
Because of the new variant, there are growing concerns around the world that the pandemic and the associated lockdown restrictions will persist for far longer than hoped. Nearly 2 years since the start of the pandemic that has claimed more than 5 million lives around the world, countries are on high alert. Many countries have already imposed travel restrictions on flights from southern Africa as they seek to buy time to assess whether the Omicron variant is more transmissible than the current dominant Delta variant.
We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people.
Meanwhile, fewer than 6% of people in Africa have been fully immunized against COVID-19, and millions of health workers and vulnerable populations have yet to receive a single dose. Health experts are worried that these conditions can speed up the spread of the virus, offering more opportunities for it to evolve into a dangerous variant.